now let's have the fireside chat sessions. Let's welcome Tony and Jimmy Ling. Welcome.
I was giving Edgar a hard time for using such a bad picture of me, and he told me that's actually what you look like. My name is Tony Ling. I'm a venture partner with SparkLabs Taipei, and I have the honor of sitting down and chatting with Jimmy Lim today. I'll give the quick introduction on Jimmy, but before I go through a list of accolades from Jimmy's very distinguished career, let me just simply summarize and say Jimmy Lim is really, really smart. He graduated Yale 2001, went on to Johns Hopkins to get his MD, PhD. He is a genomics pioneer. He actually led the team doing the computational analysis, the first ever gene sequencing of cancer, actually a number of different cancers. He was a director at the National Institute of Health in the US, and he's an entrepreneur, both on the nonprofit side, where he founded an organization called the Rare Genomics Institute, which we'll talk about. He's also an entrepreneur on the for-profit side, where he's currently the Chief Scientific Officer of Oncology at Natera, a public company in the US, where he is building from the ground up their oncology division, setting strategy, building the team, the whole works. Jimmy is incredibly well published. He's been printed in the Wall Street Journal, the New York Times, Huffington Post, Nature, Science, you name it, he's probably been published in it. And he has been a distinguished speaker at venues such as, well, SparkLabs, of course, Wired, TED, corporate events at Google. He's spoken at the White House. So again, Jimmy Lim, very smart, and we are honored to have him here today. Thank you for coming.
Thank you.
So, Jimmy, this is a conference obviously about entrepreneurship. And one of the things that we talk all the time with our entrepreneurs about, Jimmy touched on this earlier, our Jimmy, is the importance of inspiration and passion, right? You might come up with an idea, maybe you can make a few bucks, but it's really that inspiration and passion that gets an entrepreneur through the tough times, and every startup has tough times. You sort of have a unique perspective where you've been an entrepreneur on the nonprofit and for-profit side. So maybe we can start on the nonprofit side because that's probably a little less common in events like this. You founded an organization called the Rare Genomics Institute. Could you maybe just describe a little bit of what the organization does, what its mission is, and then specifically on this point around inspiration, kind of tell us a story of what drove you to found this organization.
Happy to. So I think a lot of us in life is sort of looking for big problems to solve. And sometimes I think, as we heard many of the pitches before, they run into the problems maybe in a supermarket, or sometimes they're trying to look for their own product, they can find it, and then they are they're the ones now to solve that problem. And I think that's very much sort of the journey of the ventures that I've been on. For Rare Genomics, so my background, as I said, is I worked in in cancer diagnostics to detect cancer, and we were able to do the world's first cancer genome sequencing. But then I was in a hospital seeing patients, pediatrics, and there was a little kid that had a rare disease, and nobody could help him. And this is one of the top universities in the world, top hospital, nobody could help them. And that's when you know what? There are so many of these children with rare diseases, even though they're individually very, very rare, but if you add it up, there's millions of people that are affected by rare diseases. How can we solve this? So the way we thought about it is you think about how Amazon has able to solve the problem of rare products, right? It's through a democratized platform, you can do bottom solution to be able to do that. Crowdfunding and crowdsourcing has allowed a lot of peer-to-peer types of ways to be able to solve problems that way. So we took the lessons that we learned on the commercial side and try to apply them on the rare disease. So that's what we did. So a patient comes with a rare disease, we raise funds through their friends and family, through that platform, and then we connect to top researchers to do research projects for these families. So imagine now, you raise $5, $10 from friends, But then you're funding research projects at top universities like Harvard and Yale, and researching these diseases that has never been researched before.
You know, as a father of 3 young daughters, beautiful and very poorly behaved daughters, you know, one of the scariest ideas is having a child or one of your kids get sick and not knowing what the cause is, what the disease is. And one of the things that struck me when I watched your TED Talks was how you looked at this current industry, right? The way things currently are. Biotech and pharma, it's built on a tops-down approach, where they are incentivized, largely from a financial perspective, to go after the most common diseases, right? The ones where they can make the most money. And there's nothing wrong with that. But there is this thick layer of thousands and thousands of diseases that on a global basis might have a few hundred people that get it, maybe a few dozen, maybe one. And somehow you were able to sort of invert this tops-down structure. You touched a little bit on crowdsourcing, but could you talk a little bit about how you actually kind of inverted that and made it more of a sort of bottoms-up approach? You talked a little bit about crowdsourcing, you mentioned funding research, but how did you actually kind of use crowdsourcing, at least in the beginning, and how did you build this network of experts around the globe who are willing to help out, and how are they incentivized?
So the key is, I think you learn from on the commercial side is democratization. So you solve these problems not by, this rare disease by trying to solve this rare disease, but building a platform that enables the solving of all rare diseases, right? So we build a platform, number one, to raise funds. We build a platform to connect to researchers, right? Build a platform to be able to upload your data and curate your data, and also a platform then to connect to businesses, right? So if you have a generalized platform, then you're disease agnostic. You don't care about whether you're looking at a rare disease or a common disease. So when a patient comes, then you can sort of leverage all the existing platforms that are there, then be able to then raise funds from small amounts, connect to top researchers in different fields, be able to find biotech support sponsors from different fields, all in a very sort of seamless way once you have that foundation built.
And just to be clear, the funds that were initially raised through crowdsourcing, which are now, I understand, donated for the most part, those actually didn't go to compensate these researchers. It was more just the basic sort of operating costs of performing it. Is that right?
Yeah. So average, we raised about 10,000 US dollars per project, but we have companies that donate, sequencing reagents from biotechs, hundreds of thousands of dollars. You have companies like Google and IBM donating infrastructure. So from that $10,000, we're doing these $1 million projects for these rare diseases.
Great. So as I mentioned before, you have experience on both the nonprofit and for-profit side. Could you describe a little bit what you're doing within Natera in terms of building up the oncology group? And then I think what would be interesting is maybe compare and contrast your experience as a nonprofit entrepreneur and a profit entrepreneur, for-profit entrepreneur, similarities, but sort of unique challenges of each.
Yeah, happy to. So Natera, I don't know, most people probably haven't heard of it. We're listed, we went public 3 years ago on the NASDAQ. Our revenue about $200 million last year, US. And our major market is in prenatal testing. So women who are pregnant want to figure out the health of their baby, they do a blood test. Instead of doing invasive like amniocentesis, when you take cells. We take the same technology, instead of looking for baby DNA in mom, we can look for cancer DNA in normal patients or normal people, right? So today, what are ways to screen for cancer? And if you're a woman, you screen for breast cancer with mammography, right? Which is taking a picture of your breast. But by the time you want to have a cancer, you can see it, sometimes it's too late. You also screen for colon cancer, which takes a big tube, unfortunately, through the wrong end, right? And look up and to be able to figure out and be able to see that. But that's sort of two of the cancers. Most cancers are screened too late. And the goal then is there a way we can do a pan-cancer screen so we can catch these cancers much earlier? And for most cancers, if you catch it earlier, actually there's a cure already for cancer. So that's what we've been working on, to look at these sort of small amounts of cancer DNA in individuals. So we just launched a product last year on oncology. It's called Signatera. It's now used by most of the major pharma companies now, and we're launching it clinically next year. As Natera, we already distribute in over 80 countries on the women's health side, and now we're going to start, leveraging that into the oncology space there.
And maybe compare and contrast kind of for-profit versus non-profit similarities and challenges?
I think at the end of the day, you're trying to solve big problems, right? I think, or solve small problems. And whether you do it in a nonprofit environment or a for-profit environment, it's the same challenges of, right, of the technical abilities of actually sort of solving the problem, getting the right team together to be able to do that, and funding, right? So versus sort of VC-backed money or public market money, right? Getting funding from corporate sponsors and donations is another way of sort of fundraising. So it looks a little bit different, but I think more and more these days, the nonprofit model actually is learning and mirroring the business models from the for-profit. So there's areas like venture philanthropy, where people who are starting to see even nonprofits actually generate a lot of revenue.
So actually on that point of revenue, I mean, we talk with our startups that we fund all the time about KPIs, metrics, milestones, users, daily active users, et cetera, unique users, clicks. But at the end of the day, there's a metric that we all measure ourselves by, which is dollars, right? But how in a nonprofit organization do you kind of set the right metrics, KPIs, milestones that sort of focus the organization and then define success in a way that everyone feels aligned and good about?
So a big movement in the Valley, at least, right, is companies are ultimately is about mission and culture, right? Even if their goal is to sell ads, right, or to generate clicks, people don't care less about the ads, right? They care about solving the problem and the dent in the universe that they're creating, right? So in that sense, even in a for-profit venture, right, people think about beyond the sort of the standard metrics of even revenue numbers. Even within our company, Anatera, we talk about lives saved or families affected, right? And that is one area where actually a lot of learnings go the other way, where the for-profit companies can learn a lot from nonprofits, because nonprofits have less these sort of numbers of the revenue numbers, but they're all about mission, right? They're all about how many people they're helping, how many trees they planted, how many whales are they saving, how many forests, right? So that mission aspect is already really well developed in the nonprofit space that I think the for-profit space is starting to learn, right? So there's a lot of, but then I think the nonprofits learn about market efficiencies and business operations from for-profit. So there's a lot of cross-pollination that's happening that's actually pretty exciting to see.
That's great. So Rare Genomics Institute kind of trying to build a bottoms-up approach to diagnosing and hopefully coming up with cures or at least management for rare diseases. Let's shift gears a little bit to talk about cancer, another area of expertise for you and unfortunately not a rare disease. I looked at the stats last night. 38.4% of us in this room in our lifetime will at some point get diagnosed with cancer, call it 40%. Almost 100% of us will be impacted by cancer, either directly or indirectly. And cancer is a war that scientists and doctors have been fighting for decades. And yet, from a layman's perspective, based on my own personal experience with friends going through this battle right now, based on research and articles that I read, it feels like to me, and I guess this is my question to you if my feeling is correct, but it feels like to me we're potentially at a unique point in history where this war on cancer may either be winnable or at least kind of manageable in our lifetimes. But I'm curious, as a man who's sort of on the forefront of that research, number one, does that feel right to you? And then number two, kind of what makes now different than, I mean, we've heard about promising potential, treatments for forever. What makes now different than the last 30, 40 years?
Yeah, first that 40% number, let me just poll the audience. Raise your hand if you know someone with cancer or has been affected by a family member of cancer. Right, so look around the room, right? It's basically everybody. And this thing is 40%. So, look to the right, look to your left. The odds are one of you will be affected by it. It may not, ultimately be what sort of be terminal for you. So it's a huge problem. But there's good news, right? And that's what I want to say is we are now in the golden age of cancer discovery, right? For the first time, we are developing a whole new set of sort of types of therapy before. So maybe 50 years ago, how do we beat cancer? Right? How do we treat cancer? There's two ways. You do surgery, you cut it out, and then they developed this method called chemotherapy, which is basically poison, and you hope to poison the cancer more, you poison the normal part, right? A lot of actually, the early cancer diagnostic was used in warfare, mustard gas. About 10 years ago, there was excitement in cancer that's developed called personalized therapy, right? So because through some of the work that we've done and others, is like we know what are the mutations that cause cancer, right? Can we then create drugs to attack those mutations and personalize that medicine, right? To give the right drug to the right patient at the right time. And that has been the promise in the last sort of 10 years, thinking about genome sequencing and figuring out the right drug. But what has happened is cancer is very smart. So you give these drugs and the resistance that happen. In the last 5 years, whole new areas have sort of exploded. I think this is actually the Nobel Prize is awarded this year. Is the area of immunotherapy, right? Instead of doing surgery or giving a poison or trying to figure out new ways to do it, we use the immune system that we already have, right? Which is very, very smart, right? And to teach the immune system how to fight cancer. So whether it's the top drugs these days, billions of dollars now are being used, that what it does is it's called this area called checkpoint inhibitor. Cancer has a stop, has a brake. If you drive a car, right, there's a brake. So what it's able to do is actually the drug takes the brake off. So it turns on the immune system, and that has worked miracles, and that's what's won the Nobel Prize this year, is figuring out that the brake on the immune system. And there's new ways too. People are able to take cells from your body and then teach it. If you're at the airport, right, you have dogs that smell for explosives. What we're able to do now is be able to take the cells out, teach it what cancer looks like for that patient, and then put it back into that patient's body to then attack the cancer. And that whole area too, called CAR T-cell therapy, is really, really exciting. So there's so many new ways of using our immune system that it's really making a huge change of how we're even thinking about fighting cancer. And that's why a lot of us in the area have not seen such a dramatic change, and we really think this is the golden age of cancer. And we really think that, at least this is my opinion, that cancer will become a chronic disease like HIV within our generation.
And specifically, you mean not a death sentence in certain circumstances, but a manageable
disease, right? Yeah.
And where does your research in genomics kind of fit within immunotherapy, and why is that more accessible than it was before, I guess, to folks?
Yeah, well, there's a couple things. Immunotherapy is exciting because when you want to teach the cancer to smell teach the immune system to smell the cancer, you need genomics, and that's what we do. Also creating specific vaccines for that, to do that. And then what our company does is, when you give somebody a drug of cancer, you actually don't know if it's working or not. You take a picture, so MRI or CT every 6 months, and maybe it shrinks or not. What we're able to do is measure in the blood to see, in real time, is the cancer growing? Is it expanding? So we're starting to do that in the blood. So now with immunotherapy, one of the big problems is when immune cells try to sort of fight the cancer, when you take a picture of it, so CT MRI, it looks worse because of immune cells. So imaging is sometimes has a problem. So then using ways to measure in the blood is now sort of an area of great excitement. And that's why we worked with a lot of pharma companies to be able to use our technology to start measuring in real time treatments in cancer in patients.
On the topic of genomics, there are new technologies like CRISPR that effectively enable scientists to customize whatever genes they want, right? It opens up a whole new world of possibilities in terms of disease prevention or treatment. But it also opens a potential ethical hazard. There was an article a few months ago about the Chinese scientist or doctor who had genetically modified embryos and basically given these babies, I think it was 3 babies, HIV resistance, which, sounds like a pretty good thing. But kind of how do you think about, why was that such a big issue? And how do you think about managing, we talk about the risks of AI and robots taking over the world. This is equally potentially as exciting but also risky for us as a civilization. Yeah, so how do you think about what needs to happen there?
Yeah, as with new technology that's happening, even, right, I mean, there's a lot of news of how, right, Russians hack Facebook or, right, or, hacking Google to be able to do it. All the technologies that many of us develop will be used for good and potentially for less good uses. And with CRISPR and genome engineering, we are for the first time, not only do we, about 10, 15 years ago, we read the DNA of our body for the first time, right? So we were able to read. And this is the first time we're able to write in a very quick manner to be able to do that. Then the question is, what are we going to write? What are we going to edit? And that's sort of the major question. And how are we going to do it in a way that's responsible and also good for patients? And that's sort of a very long, ongoing dialogue. And I mean, the controversy with China is, this person tried to work outside the system in areas that were potentially not medically indicated. So that's why it's a little controversy. But I mean, there's a lot of excitement too to be able to use it for good. And I think again, the exponential technologies that are happening. Imagine, right? This is I guess if we think about China and paper or Gutenberg, the press, we're only writing DNA for the first time, right? And that imagine that you're writing for the first time. This is just the beginning of how we're going to change our genomes. And we are, starting to see this excitement now.
And I think you talked when we had lunch yesterday a little bit about how it sort of falls into two buckets, right? There's sort of preventive or disease kind of benefits of modifying genes, but then there's like what do you call it, transhuman type?
Yeah, the question is, what do you use it for? And there's people who want to use it to fix diseases, which we all sort of believe in. But then there's people who want to use it to make people better in ways that then talk about potentially eugenics and transhuman. If you want to choose your hair color, you want your child to be smarter, taller. When you're doing those things, then we have to be very, very careful when we're changing that, and that's where all the bioethical discussions are.
Yeah, it's fascinating actually. I remember reading an Economist article a couple of years ago about how in China the boy to girl birth ratio has been shifted from a natural sort of 1.06 male to female, 1.06 being the magic number where boys actually typically tend to die more before they reach puberty, so it ends up being 1-to-1 perfectly by the time they get to puberty. In China, it's 1.25 to 1, which means if you extrapolate the numbers, China ends up having a population of men that can't get married or find spouses equal to the size of almost the entire male population in the US of marriageable age. And you think about adding in the option now to genetically modify your kid to be taller or better looking or have a great singing voice or smarter and great potential, but incredibly scary. So how does that actually happen though? I mean, we all understand it needs to happen in the same way that there needs to be sort of universal rules around AI management, particularly general AI, right? Self-learning machines. Who puts that in place? I mean, there's no governing body. How does this actually happen before rogue scientists, HIV prevention one time, taller the next time, better looking the next time, whatever it is?
I think it's going to be a combination of governments and then sort of scientist community and ethicists and religious leaders getting together to sort of talk about this. It's not going to be a simple answer. But it's going to be very, very important. I think what's really, really amazing about biology is for the first time, biology is becoming no longer a cells and molecule problem because we can change DNA into bits. Biology is technology. Biology is IT. Biology is big data. Biology is now AI. So all the things that we've developed on AI now is going to be moved over, and that's why we're going to see this crazy exponential shift in development. And now we're able to write genomes. So this is going to be a time of very, very fast change, and it's going to be a time of sort of great caution of how do we use the fire and not sort of burn ourselves or light the building on fire.
So I think we're coming up on 25 minutes and we'd allocated 30 minutes. So maybe the last few minutes, Jimmy, it's always helpful, I think, to entrepreneurs, aspiring entrepreneurs, to hear the story of successful entrepreneurs and how they've how they sort of made the decisions around their career, and specifically when to make that leap off, right, in a different direction. I know your parents were physicians, you went to go and get your MD at Johns Hopkins, but how did you think about sort of going student body right, starting a nonprofit, kind of going into for-profit, building an organization? Like, you could have been a doctor. You know, what's your own personal kind of story around that?
I like the intro video where Edgar talks about, is Edgar here? Talk about the sort of the dedicated passion, right? And the journey of all hard things is gonna be that thing that sustains you through the lowest of lows, right? Whether it's entrepreneurship, whether you're working a 9 to 5 in a corporate job, whether you're studying or doing research, you need something to sustain you through the worst of times, right? When things are going well, it's very easy, right? But what is it gonna drive you so that when everything has failed, all your investors say no, right? Experiments all go wrong, right? And you come home, right? And and you're just sort of sitting there in the dark and like, what do I do? But what still drives you to do that? And different people have sort of different things that really sort of drive them through that. For me, is sort of solving the big problem of cancer, and then the story of the rare diseases, and that continues. So through those dark times where everybody says no, we continue to go through. So I think that's ultimately going to be critical. I think it's not the passion for the things that are successful, it's what's going to maintain your perseverance through the darkest times. And I think that is going to be the critical factor of whether what enables you to ultimately not necessarily even be successful, right? It's just giving you that energy for perseverance so that it makes you a potential for success.
I love the story Jimmy told me yesterday. One of the patients in the Rare Genomics Institute, and the parent, he was a very sick child. The parents had no idea what was going on. The doctors ran all the tests, nothing came back. And he was, you sort of put him through your network, and they identified a genetic mutation, right, that had an N globally of 1. He was the 1. And yet there was a researcher you found that had been studying, tell me if I get this wrong, a similar genetic mutation in yeast. And so for him, it was this amazing opportunity to study sort of this manifestation of this genetic mutation in human beings. Would have never happened but for something you created. So I just want to thank you again for being a guest on SparkLabs. Thank you for doing such wonderful work that's saving lives and helping people. And we hope that you'll be a friend and part of the SparkLabs network going forward.
Yeah, I'm honored. I think I spoke at, I think when they showed the picture DemoDay 7 in Korea, I'm like, man, one day in Taiwan. And I'm so excited that now DemoDay, SparkLabs is now in Taipei, and I get to participate, so it's a great honor.
Thanks, everybody.
Thanks again, Jimmy and Connie.